right, welcome back, everybody, and thank you for joining us on another installment of TouchCare Talks. We're excited to be back, albeit in a virtual format once again. And today, I'm really excited to welcome with me Joanne Jodry. Joanne is a author and frequent public speaker and assistant professor in the professional counseling department at Monmouth University. And her specialty is mental health counseling. She's given a number of lectures on this topic as well as TED Talks on the topic. And I believe this is really at the forefront and top of mind for most employers right now as we think about sort of the greater mental health impact that the pandemic has had on employees, and how that has impacted productivity, overall happiness, well-being, et cetera. But it's really interesting because it's a problem that was present in the American workforce leading up to and prior to the pandemic. And I think in a lot of ways that the pandemic has really served as a catalyst event for employers and employees alike, looking for resources. So excited to have Joanne here with us, like I said, to speak to the topic. And yeah, Joanne, thank you for joining us.
My pleasure. I'm enjoying being here to talk about this. I feel very passionate about it.
Yeah. So, Joanne, just to jump right in, what do you think are some of the biggest contributing factors to the overall mental health crisis that we're currently facing in 2020 and in 2021?
Well, the pandemic, of course, is the biggest thing that's putting people in stressful situations. But it's the pandemic that has no reference. It's an event in our life that has no reference associated with it, and that's what causes it to be such a crisis, right? The definition of a crisis is something that happens that I don't feel I have the coping skills for, and because none of us, most likely, unless you were here in 1917 during the last pandemic, have zero reference for it. We have no idea what to do. And then we add in all the misinformation that we've been given. We've been given different people giving us different, it is a problem. It's not a problem. Don't worry about it. Mask up. We've been given so much misinformation that it added to the crisis level of stress that we have in our minds and our bodies. And so I think that the pandemic itself, the lockdowns, the events, the physicality of the pandemic, of course, adds to your mental health wellness or illness. But the misinformation then makes it even worse. Like one of my clients said to me, I feel like I'm walking in an earthquake. And if I walk to the left, I am shaking. And if I walk to the right, I'm shaking. And I don't know where to step. And I think that kind of summarizes like where we're at mentally, in that there was just nowhere to go. Do I get a vaccine or do I not get a vaccine? Even that, we're still in that because of the misinformation and different information that we continue to get. I think
Yeah,
that's a big contributing factor.
and something that to your point, likely didn't have to deal with in 1917, just the world being the way it is right now, right? And in terms of how connected we are and how real time the news is, et cetera. And I think that's a really interesting notion that you bring up, right? This idea of the physicality of mental health and sort of the isolation and that most folks may or may not be experiencing due to the lockdowns and sort of the stress associated, like you said, uh, with the confusion. And I think back to where we were in 2019, and obviously there was sort of always, for those of us in this space, a mental health crisis in America to some degree, right? And one of the biggest problems that we had as a civilization or as people was there seemed to be this stigma around mental health and addressing topics related to mental health, right? Um, so it seems like one of the important first steps is for employers to normalize speaking about and addressing mental health in the office. What are ways that employers can do that to help facilitate this in their workplace?
So, one of the things that when we think of mental health, we think of mentally ill people. That's what we think of. The word mental health usually implies someone that needs therapy. Someone's hanging on by their fingernails and now they need therapy, right? That's what we think of as a collective society. And one of the things that we should do is language matters, and we should change our terminology to mental wellness, not mental illness. We should change even mental health. It should be mental wellness. And one of the things easy for for an employer to do is to normalize it by calling it wellness. In a meeting, say, let's check in. Give me on a 1 to 10 how well you are mentally. Where's your mental wellness at today? And we don't need to even ask further questions. They can just know, do a simple check in with themselves. The other piece is that a company needs to, it's like there needs to be a congruence. The company needs to really believe that there's not a stigma attached to mental health. They need to really believe that. And then they need to act on that. So if someone high up in the company sees a counselor and they're willing to share that they see a counselor, and a person who's respected, people can go to counseling, should go to counseling, not when they're ill, but to maintain their wellness. And I think if you collectively shift that paradigm thinking, that would be very helpful. And so sharing your own experiences, I know we've seen things on television where, the royals are talking about mental health, and they're talking about how it wasn't allowed. But because they're talking about people hanging on by their fingernails, right? We don't want to get to that point. We want to keep your employees well, right? So putting up posters about mental wellness, but also talking about ways that you can keep people well. Do meditation, morning meditations, or lunchtime meditations, and just clear your head of thinking. One of the things that's going on for all of us, me, you, all of us, is a sense of a brain fog, and that's different for different people. But the days run into each other. I might forget a meeting. There might be something that I'm comparing myself to my brain before the pandemic, and our brain has to adapt to the situation, physically has to adapt to the situation. And so we don't want to ever lower expectation of performance or work, but we do want to change the way that we expect it to happen. There needs to be more of a nurturing, like, you got brain fog, I got brain fog, all right, let's make this happen. There needs to be a validation and understanding in the workplace that allows people to bond in the changes, in the new normal. One of the
Yeah.
things, yeah, I'm sorry, go ahead.
No, I was just saying, it's interesting, this notion. It's almost from a destigmatization standpoint, this idea of um, at the organizational level, celebrating mental wellness, right, rather than addressing mental health, and looking at it that way is a real way to show your employees that you're concerned about their health, productivity, and happiness, which ultimately should lead to a more productive workforce, right?
Exactly. One of the things that's important too is when things like this happen, because this is a crisis that everyone in the world is sharing in the United States, we share in it. We're a capitalistic country. Economics matters to us. I mean, it matters to everyone, but it probably matters to us a little more. And one of the things that we collectively do is we get fearful of economics. We get fearful of my abilities in the world, who I am in the world. We go through kind of an existential shakeup whenever we have a crisis. And one of the things that it's important for the employer to do is to reaffirm explicitly the meaning of what you do for a living. Money, of course, is validating to people when they get raises and things like that. Of course, that is a reinforcer. But even as equal to that is the meaning of what I do. And sometimes what you do is maybe 3 steps removed from helping someone, but ultimately it is all helping someone, right? And so we need to make sure that we put in explicitly in the workplace the existential meaning of our jobs, because
Yeah.
this often shakes us up.
Yeah, that's interesting. So, in addition to sort of breaking down the stigmas of, talking about mental wellness and well-being in the workplace, what other, I guess, strategies have you seen or would you recommend to employers who are looking to address and mitigate the mental health challenges currently and, and in the future being faced by their employees?
Well, if you're big enough and it's feasible, EAP programs are wonderful, and it's important to have them. That sends a message that we care about your mental wellness.
Yeah.
I do think that bringing it up, saying it out loud, in a meeting, and making it not a joke. A lot of times people are like, "Oh my God, I'm psychotic." Well, they're probably not actually psychotic, but we use those mental descriptive words to make jokes about it, and it's when someone is suffering, then they don't want to own it. So making sure that the culture in the workplace is not using mental illness label words with each other. One of the things that I have issue with is people use words that are in the DSM and pathology to describe non-pathological things. For instance, if I'm sad, I say I'm depressed. Very few people are sad anymore. I don't even know, we don't use that word anymore. But
Right.
often, half the time, they're just sad, right?
Right.
But now they use the word depression, which is a DSM descriptive word, to describe the sadness. Or I feel stress. I have anxiety, right? So we throw these labels on folks so quickly, and anxiety is different than stress, because anxiety is the crisis of stress. When I don't have the coping skills to deal with my stress, just being stressed is stressed. And
Yeah.
so, using the words sad and stress, using the words that are not pathological words, I think, and creating that culture, and also not making, I think it's innocent intended, but making jokes about, oh my God, I'm bipolar, because you had like a shift or something, and you say, oh,
Right.
things like that. Well, someone who really is bipolar might not want to, deal with that, because we're making a cultural joke about it in the workplace. And so being sensitive to that type of language that we're using, um, and it's led by example of the leadership of a company, using new words like,
Yeah.
I'm really feeling sad today because some sad things have happened, right? And the other thing is to say the word wellness a lot. Wellness is more important than illness, and we don't want to get to that illness part. So saying that word, I think even some visuals around mental wellness, in the hospitals, they say, how bad is your pain on a 1 to 10, well, how is your mental health wellness today? Or how is your overall wellness,
Right.
for that matter?
Right.
We here in the United States split up mental from physical. Other countries don't do that. So, because they're not really different, my stress really does cause physiological problems in my body. And so we split it up, but maybe you talk about not splitting it up. Um,
Yeah.
the other thing I wanted to mention is, there's barriers to getting help, right? There's barriers to it, like in
Absolutely.
like money, like time. And the more that the employer can remove the barriers, stigma is one of them, of course, too. But the more that the employers can remove the barriers to getting help, I think that's going to help your overall wellness of your company.
Yeah. Yeah, we faced that a lot here at TouchCare, just as as a navigator or a concierge for consumers, trying to help them find the right resource when they do reach out for help and specifically for mental health related challenges that they may be facing and looking for professional help. It can be really difficult. I think the good news is along the lines of this being a catalyst event for hopefully addressing this in the workplace is a lot of great virtual tools have started to emerge And as people get more and more comfortable with them, I think we're going to continue to see that rise as a as a real viable solution for folks. And to your point, breaking down both the access and the cost problem of getting the the mental health care that you need. Um,
Yes. And one of the things that we found is insurance companies don't always pay telehealth the same way that they pay in person, and that needs to change at this point,
yeah,
across the nation, because this breaks down one of the barriers. If someone doesn't have to commute, that helps with the time, and if someone can just be one-on-one, here, and some people are still going to want to do in person because they might not have a safe place in their house that they have privacy, perfectly fine. But to be able to offer the telehealth as an option for people is also a really good idea at the same rate that they will be reimbursed,
absolutely.
as regular.
Awesome.
Hmm.
Well, Joanne, I really appreciate your expertise and insights on the subject. It was great chatting with you, and thank you everybody who is watching virtually. And that wraps this conversation up. Thank you.
Thank you.